of long-term 2024 GPAT. Last week also we have done same kind of class, but there I have given you only the introduction of ES Pharma Education, what we do, who we are, what we do at ES Pharma Education, our team, everything. But today we have another guest faculty with us, Mr. Anand Busari. You might have seen his poster also, All India Rank 3 and All India Rank 6. So he's a performer, expert. He has done his M.Pharm from ICT. So he'll be taking the class and Jyoti madam will talk to you all. But whoever has attending for the first time today, just I'll be showing the glimpse of our presentation, what we have taken last week. You can see the same presentation last week in the YouTube channel or maybe in the espharma.in website. We have kept the complete class of last week in the website. So going forward for the presentation, this class is for purely for the aspirants who are willing to get good GPAT rank in 2024. People like these persons. Whoever 48 people are here, these are all performers last year. So before that last year, we got an even wonderful result. And this 2024, our concentration will be completely on this GPAT. The reason is this year we are mixed up with the drug inspector coaching as well as GPAT coaching. But still, we have given very good coaching for the GPAT students. And we got almost 150 students for GPAT 2023. So they are writing the exam on this May 22nd, and maybe exams results will come in 1 month, and we'll be offering them the free NIPER coaching. So let's hope for the best. What is the result we'll be getting for 2023? So coming to this GPAT 2024, long term one, we always get very good ranks. The reason is their consistency for the 1 year. But people who join at the last, like maybe 40 days, 30 days before the exam, the result will be very less. The reason is they are not equipped with the complete knowledge and just they attempt the exam to throw the stones. But whoever is serious to get into an MS level, M.Pharm level, this is the right time to start the preparation. Fine. So let's get into this presentation. See, in our academic curriculum, there are 4 years important in every academic curriculum. One is intermediate 2 years, second is PG 2 years. People will not recognize you, people will not respect you, people will definitely, what we call, they will judge your performance based on these 2 years only. One is intermediate. Whatever course you choose in +2 by PC or MPC, that will decide your graduation. Again, in the graduation, whatever may be the college you read, that may not have much impact, but where you are completing your M.Pharmacy or MS is important. It is in a NIPER, or it is in ICT, it is in Manipal, it is in BHU, it is in a university, it is in normal local college. That will decide your entire career path. That is the reason I strongly urge all the students of B Pharmacy, forget about where you have read your B Pharmacy, where you have studied your B Pharmacy, but make sure that you will complete your M Pharmacy in a very good reputed premier institute of India. That is how our pharmacy professional will improve and will be part of contributing something for our pharmacy profession. So moving forward, many people know ES Pharma Education. It's a one-stop solution for all pharmacy entrance exams. Just I'll rush through the slides. I will not go in depth of this presentation. Anyway, we have done it in the last time. So for this today, we'll focus more on the academics part. So we started our journey in 2010 with the name of Formula Academy, where team of all NIPER alumni 2010 batch. So they came together and we started this batch. We have started coaching, giving up for only 5 students. Out of 5 students, 3 people got into NIPER Hyderabad. That is where our success story has started. And from till today, we have done almost 1,000 plus alumni in NIPER. So this is our humble beginnings in 2010 with Mr. Prakash Diwan sir. He is the first NIPER director of Hyderabad. So we started our journey with very few people with a team of NIPER alumni Hyderabad, and today we can proudly say ourselves that we are creating a lot of impact in the pharmacy profession. So we give all the coachings for starting with the GPAT until PhD level. So we give coaching for the PhD exams also. and we give coaching for the government pharmacy exams. We give coaching for the international pharmacist exams. We have run a couple of batches for Canada, PEVC, who want to become pharmacist in Canada, who want to become Australia pharmacist. We have given coaching for these CAPS also. So multiple courses are there. But our intention is that any student comes to us, he should has to get some solution from us. So as I shared last week, we have a group of people who are really passionate to teach the students. They all went through a phase like you, not having a proper guidance from the colleges, not having proper guidance from the seniors. They somehow got into NIPER with their preparation plan, strategy, everything, and they made it possible. And with their passion, they want to bring fellow budding pharmacists to premier organizations. That is where we have almost 200 plus who are there who are working as a part-time kind of thing. They come to us in their free time and they give classes to us. But to lead this entire team, we have two persons here. One is myself, Uma Shankar. I take care of all the admin operations. And Jyotishri madam, she takes care of all the academics part, where she'll be responsible for bringing the best faculty to you. And my responsibility is whether the classes are going smooth. If you are looking for any kind of extra classes, extra materials, any kind of support related to admin, I'll be the one-stop solution. And Jyoti madam will help you in terms of the academics, giving more exams, more materials, all those things. So this is one of my favorite quote, and whoever joins in ES Pharma Education, this will be like a mantra. So from last 5 years onwards, I'm promoting this quote to each and every student. By the time they complete their NIPER recruitment and the NIPER admission, this quote has to get in every cell of your body. The best way to predict your future is create it. So I say this to all the students. If this year you are celebrating your Diwali here, next year you should celebrate your Diwali in NIPER Mohali, NIPER Hyderabad, wherever you wish to go. That is what my always prayer as well as affirmation also. But only thing is that you have to decide from your side. Today we got 32 people here. Why not 300 people? Why not 500 people? Why? Because they are not sure how much impact will be played in their careers. So మనకు జనరల్గా ఎలా ఉంటుందంటే ఫర్ లాంగ్ టర్మ్ వన్ బ్యాచ్కి వీ గెట్ ఆల్మోస్ట్ 100 to 150 స్టూడెంట్స్. But at the end of the result, almost some 60-80 people will qualify. The reason is they'll give up. They'll give up because they can't put that much of efforts. They feel that, sir, not only those people, if I ask you the crowd of these 33 people, ఒక్క 4 years మీరు వెనక్కి వెళ్ళే ఆపర్చునిటీ దొరికితే, ఒక్క 4 years మళ్ళీ మీరు ఎంసెట్ ఎగ్జామ్ టైంకి వెళ్ళగలిగితే, హౌ మెనీ ఆఫ్ యూ చూస్ బీ ఫార్మసీ? 99% people say that, sir, బీ ఫార్మసీ కాకుండా ఐ విల్ గో టు ఎనీ కైండ్ ఆఫ్, అట్లీస్ట్ బీకామ్ ఆల్సో ఓకే ఫర్ మీ. Am I right or wrong? Can you give reply in the chat box? ఒక్క 4 years వెనక్కి వెళ్ళగలిగితే, సార్ నేను బీఫార్మసీ ఖచ్చితంగా జాయిన్ అవ్వను, I go for any other kind of, even BCom is also fine for me. Right? People are there. 99% of people, even myself when I joined B Pharmacy, when I came out, till today also people are in the same kind of mindset. B Pharmacy doesn't have any much career. Even B Pharmacy doesn't have any placements. But that is all completely myth. People who succeed their PG in good top university level, they have best packages and they're enjoying life anything. I have seen so many of my friends. So on this slide, just I would like to relate the best way to predict your future is create it. You have to create your future for the next 1 year, and we will show you the guidance how you can do that. So why GPAT is important? More than me, even Mr. Anand Bushari will get you through this slide. He has having much depth of subject knowledge. So here just I would like to show 3 examples. One is Pawan Naik, from nowhere to NIPER Mohali. It's a long jump. And we have Pushpa, who has academic gap of almost 8 years, from nowhere to, again, NIPER Hyderabad. And not only getting good rank in GPAT NIPER, she has scored gold medal in analysis branch for the year of 2018 to 2020. As I said, these are the rankers of 2021. Indraja from ANU College. You can see here, GPAT 85, NIPER All India rank 4, This is a great achievement for ES Farm education, even for me as well as Jyotishree also. So we couldn't able to trust. We thought that okay, we'll make people qualify, they will get into NIPER. But getting NIPER rank all India 4 is a big achievement for us. So I'm expecting similar kind of responses from you people also. I'm wishing you all the best. From today, you start your journey. Definitely, I'm 100% sure that next year you will all get very good ranks in NIPER. Yeah, this is another example, Farid Basha. The good thing is that just one important point with this guy is that he has backlogs of almost 7 subjects by end of third year. He has cleared all the subjects in the final year and he got into NIPER. Hey everyone. I'm not playing any videos here. Just you can go to YouTube. You can see everyone testimony is there. Even last year rankers also Brinda Harika and we have Kinner Sai. All those people I have kept the testimonies. But for the sake of time, I'm skipping the slides. Indraja. And we'll be arranging sessions like this with all the toppers of 2023. So why I'm showing all these things? Seeing is believing. Many people may be having doubt that sir semester exams lone maku tough ga undi. How can we get this good GPAT rank or NIPER rank? But trust me, with the experience of last 10 years in this GPAT coaching, I have seen so many people who got into backlogs, who doesn't have any confidence, they got into NIPER. So it is not my confidence on our coaching or on you people. By the experienced I have seen from last 10 years, I can strongly say that if you can take decision today and start your preparation from today, the 1 year span is very huge time for you and definitely you will get very good rank. So our process is very simple. We make okay. Let me skip all these slides. Let's get into the presentation. So this batch details also I have shared last time. YS Pharma, maybe you can decide. I can give n number of points, hundreds of reasons why you have to join as ES Pharma education. We never give any kind of publicity, marketing strategies, sales strategies for ES Pharma to join for GPAT. People only join with their references by senior reference, or maybe some faculty has referred them to join with us. So only one point we need to remember. We are doing with a lot of pain, with a lot of passion, and people are making it useful and they are enjoying their life in the pharmacy. So various batches are there, but the advantage with this first batch is that they will be getting access to all the classes. This is one of the best thing, and you will be having immediate response from all the team. And we'll be conducting series of mock exams like this, and we'll be displaying not only for ES Pharma students, this exam will be there for across the India, so that you'll be knowing where you are standing in the competition. So this is our office at Amirpet, and we have another in Warangal, and we are planning to launch again in Guntur also. So you can take a screenshot of this, where I have kept some contacts here. Ashwini is there, Anusha is there to help you out, and here this is Jyoti madam number, and this is my number. For any concern, any kind of questions, you can immediately drop a message to us. We'll be helping you out. But ఒకటే నేను చెప్పాలనుకున్నది ఏంటంటే GPAT is not tough exam. Only thing is that people has created that mindset. Unless and until you are not a topper, you will not get any GPAT rank. But ఈ ఒక్క పాయింట్ తీసుకోండి. Entire my presentation, you have seen Pawan Naik, you have seen Farid Basha, you have seen Indraja, you have seen Pushpa. If they can do it, you can do it. Very simple strategy. And it's very easy also. But the only thing is that people has lost some interest in the GPAT, that maybe they can go for a part-time kind of pharmacy, just going for the attendance, and they can take job in some company. So ye kind of mismatch wala, that will be huge loss in future. Done. So with this, thank you very much once again for joining this session. And any kind of doubts, you can just ping us on the WhatsApp. We will be happy to respond. Thank you. Thank you all.
Yeah, thank you. Can you hear me? Yes, I'll quickly go through the syllabus of what we are going to do all this 1 year. just a quick review of 5 minutes. I'll hand over the session to Anand. So this is like first, actually this one also I have shared the last seminar. Mm, Overall, this for this long-term batch one, we are having like conducting classes of 300 hours to 350 hours, and separate mock exam series also. And last time I told that if you have gone through the GPAT syllabus copy, it is somewhere around comes 52 pages like that. But in that, we will segregate what we have to this with the eminent faculty, what we are having from the NIPER and rankers. I have done this syllabus copy. So in this, like we are giving various number of hours based upon the subject. The toughest subject is like pharmacology, which is giving somewhere around 100 to 90 hours. And pharmaceutics now, Anand is his specialization is pharmaceutics. He'll take a few subjects of pharmaceutics as well in your batch 2024 GPAT. So first of all, he will, before starting his session, he will give overview of GPAT. Actually, what is the importance of GPAT and what are the colleges you have to select, and what are the like career opportunities we have and everything. And he will be dealing with the questions, the pattern, how the questions will be getting in GPAT exam and everything. And afterwards, he will go into the subject. Maybe I think he is covering physical pharmacy today. One topic of physical pharmacy. Before that, he will be dealing with what is pharmaceutics and how many different areas you have to cover from pharmaceutics in GPAT point of view. So we are giving like 60 to 80 hours for exclusive pharmaceutics part. And coming to pharma analysis, you have to cover two major subjects, spectroscopy as well as chromatography. And apart from the spectroscopy and chromatography, the other important parts are like titrimetric analysis, analytical part and everything. So for this, we are going to give some, I have written here the minimum, but the faculty is somewhere taking around like plus 10 plus 15 hours also. So somewhere around 40 to 50 hours we are allocating for analysis. And chemistry part, we have segregated into pharmaceutical chemistry, like medicinal chemistry, organic chemistry, and inorganic chemistry. So for this organic medicinal chemistry, like 26 to 32 hours, and organic chemistry is taken care by Anupam sir. His for the last batch, he has taken somewhere around 60 hours only for organic chemistry. And pharmacognosy also, pharmacognosy for the last batch, like it went up to 32 hours. Pharmacognosy, like entire like major families and everything, all plus glycosides, everything we'll be covering. And a few people will ask, apart from these major subjects, you people will cover minor also. There is nothing major, minor. In regard to this rankers point of view, they'll treat each subject like equally. So we will be covering all the subjects. So that we are going to cover this biochemistry allocated 16 hours, and microbiology also. I'll be taking microbiology, and I'll be taking few parts of pharmaceutics. Actually, I am from pharmaceutics background. Apart from this few topics of pharmaceutics, I'll be dealing with this microbiology part. And we were allocating 8 hours for this pharmaceutical jurisprudence as well as management. This is what about this syllabus part. And apart from this, coming to the exam series, this exam series, I haven't changed the dates. This is like previous like 2021 batch, but the exams are same. We have segregated into 3 different series. Previous year papers. Previous year papers means like we have started the exams, like not this is GPAT, GATE exam series from 89. So 89 to 2023 papers. So we are like dividing into 2-year papers as a one paper, 125 questions. So like first of all, I'll be covering with the previous year papers. So you may ask, previous year papers means it will cover entire subject, right? How you can conduct in the earlier stages. First, you give a trial of this previous year papers, and again the same papers I'll give one more attempt at the end of this, like November, December, in that like time, I will give you one more chance also, right? So the exam series is divided into first previous year papers, afterwards like subject wise, and next this is like mock exam series. In between this previous year papers and subject wise, we are having topic wise exams also for all the topics. Like for example, you take pharmacology. In pharmacology, for major topics, like we are having subject topic wise questions also. For example, if it is a big big topic, diabetes, diuretics, like that, you are having 60 to 70 topic wise bits. If it's a small topic, antiviral, antifungal, like that, it is like somewhere around 30 bits. You can work out apart from this subject wise previous year papers mock exam series, you can work out the topic wise series, topic wise also. So this comes as a package along with this classes, right? So mock exam series, and finally now we are conducting those who are attempting 2023 GPAT. We have conducted like we have started the exams from May 1st onwards, and now they are writing exams, and it helped a lot. 2021 people gave me the feedback, 2022 people gave me the feedback, the same feedback. All these, those who are like attempting this grand test, like it will definitely work out. That's why like I'm asking the one who are attempting now to, if you want, if you people are attempting in third year, you can also have, you can also give a try for this papers. Directly you can go to our spharma.in and can like directly click on mock exam series. 7 mock exam series will be there. So still you have time till 2023. If you are joining with us or not, it's like a secondary. But if you wanted to if you are attempting this exam in the third year, you can also go through this, right? So our site is like spharma.in. So already sir shared this, right, this is our site. Just a moment. So here you can go through this. So this is our site. So this is the exam series. If you want, you can also give a try. If you are joining, we will give the access for this 2024 GPAT batch. And apart from this test series also, we will give access for this. And in this 2024, we are going to give 2023, all the 2023 classes also, right? So this is those who are taking long-term batch 1, they'll be getting access for long-term batch 2, short-term, as well as crash course also, right? Still any doubts? If no, Anand sir will start the class. If you're having any doubts regarding this academic part, so what will be getting in this long-term batch 1? Long-term batch 1, you will be getting live classes, recorded classes, 4 volumes of materials, as well as like complete test series, what you have now I have shown, right? All you will be getting it, right? So you will be getting this classes access. Apart from these live classes, I said recorded classes, you will be getting classes access till the day of like your NIPER exam. Okay then. So we are having different faculty for various faculty for different subjects. Right. Okay, Anand. We can start the class.
Good evening, everyone. Hope everyone is listening to me. Hope everyone is able to listen. Now, student who are sleeping, just wake up, fresh up your minds. Who are lying on the sofa somewhere, who are thinking that we can listen like this, just wake up. Just wake up and keep your 100% mind here, because any question can stuck up any question can hit to you at any time. So just be ready for that. I can take any of your name and I can ask them to answer that question. So everyone is ready, and this I ensure all of you that this webinar will be a beautiful webinar for you. Just very important session, very important things to know, very important things to understand, how to study, what pharma colleges are there, what opportunities you will get after this exam, because anything we are doing, just anything, everything is we are doing, whatever have the importance. If you go for any exam, what opportunities you have rather than going for the, everyone wants results. So after scoring marks, after getting good results, what opportunities I can get, everybody can ask. So for those who ask for the opportunities, I'll tell them what opportunities this area will open for you if you crack this exam and top this exam. Then I'll just share you just brief exam details. Apart from that, everybody will tell you how to crack the exam, but I'll tell you what typical attitude this guy can carry who are always go ahead for the topping exams. What exactly attitude they have? I'll just ensure to make make to know that these students have the student who are having bright future, how they approach for the studies, then how to study, then books to refer. Uh, Many people must be having that how I can cover my semester along with this national test. To them also, I have some strategies how they can go ahead for this national test along with their semester without scoring less in the semester. How can get topper in this exams as well. So apart from that, very important, very important, I can say this, how to answer the question. Many people have their huge studies, but they are not able to hit right answer to the questions. To them, I'll tell you that how to convert your studies into this score. Nobody will tell you that. I'll tell you how to convert your studies into this score. Most of the student able to study, able to cover the syllabus, most of the syllabus, but they are not able to match the right score. Why? Because they don't know which question to leave and which question to answer. To them, I have a good idea and strategy to hit for the question. So just be alive during the session, no sleeping and no lying anywhere. Please, next. So what top pharma colleges are there? After doing B.Pharm, you are having GPAT. Just go on next. So you will be having opportunities in the, after cracking GPAT, you will be having opportunity for NIPER JEE. In NIPER JEE, you are having various courses, MS Pharma, M Pharma. After M Pharma, you will be having MBA Pharma. You will be having MTech Pharma. If you get GPAT or JNE or GATE exam, after that you will be having opportunities in the ICT Mumbai, where you can do M.Pharm, MTech. After that, there are various branches of the MTech we have in the ICT, Green Technology, MTech Pharma, MTech Biotechnology. So various opportunities you will get after this. Please, next. So apart from these two colleges also, there are various colleges who will make sure your entry after this GPAT exam. I can say you not but least, it's IIT BHU offers you M.Pharm. Apart from that, Punjab University is very good university. Jamia Ahmedabad, Delhi, and DIPSAR, Bombay College of Pharmacy. These are good institutes who will give you the opportunities for the placement as well as for the PhDs. There are a few courses, integrated MTech PhD in CSIR, and recently the update I got is the NIPER also started this integrated MTech PhD that will ensure you 25,000 stipend starting from masters only, and you will get surely get admission after 2 years. You will surely get admission into the PhD So that is good opportunity for the NIPER students. So this is all the courses what offering by the different colleges. Please go next. There are opportunities in the private sector will be open if you study for the GPAT. Along with that, your studies for these all government sectors will be opened. So I can say you will be having opportunity to become a pharmacist in the government sector in CGHS, ESIC, defense, railways. There are n number of opportunities in the state government as well, district headquarters, municipal corporations. If you go for this the class 2 officers exams like UPSC, different PSCs are there. Staff Selection Commission also takes exam for this. After this, whatever exams concerning to the drug inspector, scientific officer, all those exams, I can say having same syllabus of the GPAT. If you prepare for the GPAT, you will cover all those exams along with that syllabus. So I'll make sure you, if you will not succeed in the GPAT, you will succeed in these exams if you study for the national test. But don't go study for this low level semester exams, and you are saying that I have achieved so many things by scoring the semester. No, you have to go for this national test and you have to cover all the syllabus of 4 years, and then you are a well prepared candidate for these exams. Next. So I can say opportunities in the private sector will be open after diploma in pharmacy also, and BPharm, MPharm. You will be having opportunity in the production, quality control, quality assurance, sales. Please go next. If you go for the private sector in R&D, yes, R&D minimum qualification required for research and development is MPharm, and PhD guys will be there, postdoc guys will be there. So the minimum after the minimum qualification of MPharm, you can be a scientist, but you have to be from the top colleges of India, unless and until you will not able to go for the research. For research, at least the qualification required is MPharm, and that too from the very good institute. There are 4 or 5 institutes which are premium institutes from India, which I already spoke to you, and those institutes will offer you good placements in research and development. I can say you there are 5 different areas. Please go behind back. So after this, I can say you the MPharm chemistry people will having opportunities in the API synthesis and API analysis. Students who are doing MPharm in pharmaceutics will be having opportunity in formulation R&D. Students who are doing in analysis as well as chemistry who are having opportunity in analytical research and development. People who are doing in pharmacology will be having opportunity in clinical research, and people from any branch can go for the regulatory affairs and intellectual property management. Please go next. So various MBA programs also will be having in the different colleges, but this GPAT will open you gate for the pharma MBA in NIPER. Please go next. Go next. These are different exams for this non GPAT candidate who wants to give other exams for those. So this gate only GPAT only will open you for the this pharma MBA. So need not to give these exams for the pharmaceutical people. If they are very good in the pharmacy, they should give exam of GPAT and go for the pharma MBA in NIPER. Various good opportunities are coming there for with very good packages from different IT companies as well. Please go next. Now this is very important to know what exactly the typical attitude of these toppers they have. We know that how they must be studying, how they must be having what type of brain they are having. Nothing different from you. Everybody is having same amount of energy in their brain, but I can say everybody utilizes their energy for different kind of purposes. So if you utilize your energy in the proper way, proper fashion, I can say you can be a topper. Just this sixth rule, follow this sixth rule. First, I can say get completely involved. Whatever you are studying, whatever you are preparing, whatever you are doing, just get completely involved into that. Even in your dreams also, it should come. Whenever when I was studying for the GPAT, in my dreams also, I used to have thoughts of this this adrenaline, cholinergic receptors, and all those M1, M2, all those receptors, everything. So I can say you, if you get completely involved into that, your thoughts, your emotions, everything put into the syllabus, you will get completely involved into the syllabus, and I can say you surely get succeed. Then second thing is continuous revision and discussion. What we will do, we will study and we will forget. So this type of habit we have to forget about that. Why we are studying? First, we are studying to give something to the country, to give something to the nation. And if you are studying today and if you are forgetting tomorrow, then what is the importance of your studies? So continuous revision to the studies are important. Whatever you are studying, that tomorrow, day after tomorrow, whenever you think that it will go from my mind, just click it, go back into that syllabus and study again. So continuous revision is important. Apart from that, discussion with your whatever the study partners are there, we have to discuss with them whatever you have studied today, tomorrow. Then proper planning of the studies. So what I can say, which subject to be prepared first, planning, what comes into the planning, how to start, where to start, which part to cover first, which part to cover later. So what I can say you, to plan, then start with first year syllabus. What first year syllabus will tell you? First year syllabus will give you base. After that, go for second year syllabus. After that, go for third year syllabus. Then go for final year syllabus. Everybody will take a big bolus into their mouth. Don't go for the big bolus. Just go from the small, build your with small bricks. I can say you, if you start from the base, if you start from the first year, then second year, then third year, if you are going for pharmacology, then start from human anatomy and physiology. Study physiology of heart, then go for the pharmacology of heart, various drugs acting on the different parts of heart, different physiology of heart. If you don't understand the heart completely, how can you understand the drugs acting on the heart? So I can say you, human anatomy and physiology, you have to go first, then you have to go for the pharmacology. If you are going for the chemistry, medicinal chemistry, then first you have to read for the organic chemistry, then you have to go for the heterocyclic chemistry, then we have to go for the medicinal chemistry. Directly going to do medicinal chemistry, understanding the different big structure will not be able to remember so long. So create your base first. If you are just entered candidate into the final year, or you are just giving the exam of 6th semester, or you are just the third year candidate, finishing your third year, or your third year candidate, it is a good opportunity to create your base first. So before creating the base, I can say there is nothing to go ahead, and there is no big syllabus. If you create a base, if you don't cover syllabus also, sometimes because of your base, you can even think and logically answer the question. But if you don't have the base, and even though you have studied that question, and if question is asked differently, you are not able to answer that question. So proper planning of the study is very important. Then time management. Please go behind. Then time management is very important. Now somebody may be considering that today I am not having exam. This is not a semester exam, brother or sister. This is not a semester exam. This is the exam of national level, and you have to be ready every day, thinking that tomorrow is my exam, thinking that tomorrow is my exam. So this is by this by this way you have to study. By this way you have to manage your time. Even though you are doing any other task, you have to study. Even though you are traveling, you have to study. So what to study during traveling? During traveling, whatever part you have studied, just revise that part during traveling or during any other task you are doing, which is not really a task which is taking your attention. So what I can say you, the time management is very important, and the time which you are having the what I can say you, a cool time where you are only studying, not doing any other things. That time the you open for the new chapter where you are where you don't know anything. And if you are doing any other thing and if you want to study, that time you open the chapter which is already studied, just you have to revise. So revision you do in the your other things whenever you are doing. And the new topic, if you are studying, that time your mind should be alert and you should be at one place. So that time you can having your normal peace time you can use for that. So next thing is avoid neighborhood competition. And I can say you guys, if you are competing with your neighbors, then you will never succeed. I can debate you. If you are competing with your the table partner in your college, I can say you will never succeed. If your table partner is getting 18 marks and if you are getting 17 marks, and even though you are getting 17 and you are unhappy, that is meaning that what that mean is you are jealous from that guy sitting with you. Just don't get jealous with your neighborhood. You have to think that in India 40,000 students are sitting for this exam. 40,000 students at one time. You have to compete with those 40,000, not with your neighbor candidates. So don't think of the neighbor candidate, just think of entire India. So you are in the India competition or India level competition. Don't go for the neighborhood competition, and prepare in that way, and get involved in your neighborhood and discuss with your neighborhood, so that you all should get succeed in your exam with hand in hand with each other. I have my memories of hostel in my mind. Whenever we used to study, we used to discuss. Sometimes we used to discuss with juniors. Sometimes we used to discuss with classmates. Wherever I studied, there in hostel, nobody remained unqualified, because the environment made by us were very clean environment without any competition with each other. By seeing the competition of national level, we used to study and we used to discuss with each other, and we used to be go ahead in hand. So everybody got good ranks, everybody got good qualifications. Apart out of 30 we got qualified, 27 we qualified. So this is the beauty of combined study, and this is the beauty of avoiding neighborhood competition. Then consistency is very important. If somebody is coming and saying that today I have studied for 12 hours and tomorrow you are sleeping for 12 hours, that will not give you any kind of success. I can say you, if you study for 4 hours today, if you are studying 4 hours tomorrow, day after tomorrow 4 hours, the consistent candidate will get good results rather than the fluctuating candidates. I can say you go consistently with your studies, you will get succeed. Next. So how to study? I can say you start from the basics. Anybody who is starting from the basic, I already said you, then develop a thinking ability. Don't much rely on the whatever part you have already studied. Just rely on your basics, so that you can have a thinking ability. Just like if somebody got the idea that if polar drugs can easily get soluble into the water, and if you have a structure of, for example, structure of any lipophilic drug in mind, means carbons are there in the drug, and there is no any polar drug into the, and in the question you ask about the the solubility of that compound. You should able to understand if it is soluble or not based on its structure. Means it's your thinking ability based on your basics. So I can say you, if you know the functional group of that compound, if you know the structure of that compound, from structure itself you should get to know that this compound is having this much solubility into the water, and this thinking ability I want from you. So third thing is interlink and correlate the subjects. I can say you there is interlink between the pharmacology and chemistry is there. If you understand the chemistry of benzodiazepine and chemistry of GABA receptor, you will be able to learn pharmacology and chemistry along with each other. Then correlate practical with the theoretical knowledge. Whenever you are doing practical, read the principle of those practicals you are performing. If you read the principle, there must be any mechanism. If you are doing synthesis, means that synthesis coming in any of the mechanism of synthesis. Read that mechanism. At least you are doing, if you are reading something, means you are doing the syllabus of GPAT only. So go ahead, read that whatever practically you did, read the principle, read the mechanism, read, understand. If you are doing practical of pharmacognosy, if you are having transverse section, read what parts of transverse sections are there, what is xylem, what is phloem, what is exactly stomata, what exactly trichomes are there. So there is huge part of the practical to read for this GPAT exam also. So whatever practical you are doing, read that practical. Then don't waste your time. If you done with your practical in 1 hour and practical is of 3 hours, you are wasting 2 hours with talking with each other. Don't foolishly talk with each other. Just utilize your 2 hours for the other studies. Then whatever you are studying, pick out the points which, if you think that this is the point which only I can consider ratta point, or this is only the mugging points. This does not require, means this does not having any logical thing, just have to mug up the things. That part you have to paste on wherever visible places are there, paste on the places, and every day see it and mug it up. Okay, please next. And whatever knowledge you are getting from the study, share it. Sharing the knowledge will build your revision. Please next. So different books referring for the GPAT, you will able to understand by list, by giving list only. I will not explain you these things. Just any convener will share this slide with you. Which part, which subject to be studied. I will not explain this. Please next. So how to study your GPAT along with the semester? Don't give much time to the semester. I can say you don't start for the semester preparation till 1 month or 2 months from the semester will remain. Before that, prepare for the other semester part which already you covered up to this 6th semester, and then go for the 7th semester studies. You if you are preparing for the new 2024. Then while having sessions, make the points for the GPAT as well. Your sessional, whenever you are studying for sessionals also, in between make points for the GPAT, so that once you complete your 7th semester, you don't have to study 7th semester for the GPAT at all. What I'm saying, if you are studying for the 7th semester, study it for GPAT as well, so that after completing 7th semester, you don't have to study again for the 7th semester. Okay, na? Then 3 months of the semester used for preparation of first to third year syllabus. Means before starting the before coming semester near, just study other syllabus itself only. Don't go for the main semester syllabus. So please next. So NIPER part I will not cover. Just whatever when NIPER will come, I'll just go through it. Then how to solve the question paper. How to solve the question paper. This is very important topic to discuss. Okay. First is strategy to solve. Second is how many questions to attend. And third is which question to solve and which question to leave. Right. Now, in the first picture you are getting to know about Mr. Bean. Mr. Bean is not, he has seen the question paper and he lost his mind. He has studied, prepared well, but he is not able to solve any question because he's thinking that question paper is very hard. See, if you've seen starting questions, 4 or 5 questions, and you are judging entire question paper, then you will lose your confidence to solve other question paper, other questions from that question paper. I can say you 125 questions. If first 10 or 15 questions you are not able to solve, then don't judge entire question paper saying that this question paper is very hard and I am not able to solve it and I will go, my studies will go into the veins. Don't think so much. Okay, go for next. If you are not able to solve that question by thinking for a 1 minute, for thinking for the 30 seconds, 35 seconds, then click for the next. Don't waste your much time on that question. Think for the next. And if even if you are not able to solve first 15 questions also, don't demotivate yourself. Don't demotivate yourself. One of my senior gave exam when I was in third year. He was saying that, hey Anand, this is very tough question paper and etc. etc. The first 20 questions I didn't able to solve. I got frustrated about it, and he lost his confidence, and he scored 90 marks into the exams. I know he was very good in studies. I know he was very sincere guy, but he was not able to solve entire question paper and he got 90 out of 500. Why? Because he was frustrated by seeing the first 15 to 20 questions, because first 15 to 20 questions were not in his bucket. See, if you able to solve 70 questions correctly, 70, 80 questions correctly, first 15 or 20 questions are not in your bucket, then also you are able to top the exam. You can be a first rank also. Doesn't mean if first 15 questions are not able to solve, you are not able to solve the entire question paper. And then again, what we have to see, every question will not come whatever if you think that every question will be whatever I should read only, not, it will come. Sometimes you have to logically solve it. Sometimes it will not come from the syllabus what you have already covered. Sometimes it can be from the syllabus which is you have not covered, but you have to logically solve it. So sometimes some questions you have to solve logically. Then second question, many people ask me that how many questions to attend? How many questions to attend? See, sometimes solving 80 questions is also enough, and sometimes solving 100 questions is not enough out of 125. How I can explain you? If sometimes question paper is very hard, and if you are thinking to attend more question, don't go for more question. If question paper is very easy, then go for the more question to attend, because everybody will, if question paper is easy, everybody will get good score and the cutoff will be high. And if you think that question paper is very hard, that time cutoff will be very low. And if you solve less question also correctly, you will be able to top the exams. And if sometime question paper is easy, that time you have to attend more questions, saying that cutoff will go high this time. This is the reason you have to be flexible from attending questions. But I can say you minimum 80 questions you should attend, 70, 80 questions you should attend, and maximum you can attend out of also. But based on the level of question paper. Third is which question to solve and which question to leave. This I will explain you in my next slide. Please go for next. But stop. Just stop. Which of the following drug is present in hemiacetal form? Can anybody tell me? Can anybody tell me? Can anybody tell me which of the following drug is present in hemiacetal form? Varun Kumar is saying second one. You have to say why. Because if you are not, I can say this question directly you must not have got through. So this for this type of questions, what you have to do is you have to understand the chemistry of aldosterone, chemistry of progesterone. So you must be knowing that hemiacetal is the reaction. Hemiacetal formation is the reaction, which reaction always required OH and aldehyde and OH groups at the subsequent carbons, and that is present in the aldosterone. Okay, see, the name itself indicates aldehyde, aldosterone. So this type of question you can solve logically if your chemistry is very good. So that is the reason I can say you, if you even don't know about this exact answer of this, you can logically solve this question. Don't leave this type of questions. Please go next. Please go next. The rate of drug transport across a cell membrane by lipid diffusion depends on all of the following except. The rate of drug transport across cell membrane depends on all of the following except. You must be knowing about the drug transport, right? Diffusion drug transport, right? Across the cell membrane by lipid diffusion, right? Passive diffusion will be there. So passive diffusion depends on the molecular size of drug, right? Less molecular weight drug will transfer faster than higher molecular weight. You must be knowing, right? Concentration gradient is also important. Surface area also important for transport. But the density of transporter important in active transport, because transporter is important in this case, right? So this is the reason you have to understand this kind of questions and solve it. So density of transport is the correct answer for this. Please go next. Drug least likely to penetrate across membranes. Can anybody tell me which drug is least likely to penetrate across the membranes? Anybody from you? Anybody from you is able to say me which drug is less likely to penetrate across drug membrane? Protein bound drugs are not able to penetrate, right? Because once they bound to the protein, they will become bigger, and bigger drugs will not able to penetrate. Please go next. Excretion of penicillin is drastically reduced in presence of probenecid because it competes for excretion through. Is everybody able to listen me? Everybody able to listen me? Okay. Then please answer the question. Probenecid and penicillin transport for which kind of transporters? Penicillin is having COOH group. Probenecid is having COOH group. When they come across there for the excretion, then COOH, if ionizes, what it form? COO minus, means they will be having competition for organic anion transporters. Anion means minus, right? So question you can answer, you can logically take out of it. Please go next. So now for these kind of questions, you cannot go logically, because unless and until you studied for this anakinra, which receptor? Anakinra is which receptor blocker? Is there, if you have studied, you can directly put the answer. But if you didn't study for it, you are not able to answer it correctly. So this is the reason for this type of question. They don't, though it looks very simple, but no logic works for this. Only studies will work for this type of questions. Even your basics will not work here. You just every time, if you not studied this kind of this classification of the pharmacological classification of the drug, then you are not able to solve this question. Anakinra is A. Balashankar is saying A. Interleukin 1 receptor antagonist. Please display the answer. Yes, that is correct answer. Please go for the next. Disintegration test apparatus has 6 tubes, which are 2 inches long, 3 inches long, 4 inches long, not specified. This kind of question required reading only. So if you read this kind of question, then only you are able to solve. There are specific tests, disintegration test, then sterility test. This kind of tests are there for the pharmaceutical dosage form that you have to study, and then only you are able to solve these questions. So USP, IP test you must have studied for these tablets. So can anybody tell me that how many inches long this disintegration test apparatus tubes are there? So this is 3 inches long tube. Answer is 3 inches long. Okay. So now I'll just ask you one concurrence, that can we go ahead for the next session where we can study for this one topic, or we should stop here? I'm asking to you only, so I should not bore you. Should we go ahead? Should you stop? Don't hesitate. Directly say. Okay. Anybody wants to stop me? One topic we will take if you say yes, and that is rheology from physical pharmacy. Okay, thank you. I'll go ahead.
Anand, before that,
Please open the slides.
yes,
madam.
Before that, you said like for 2 to 3 minutes about pharmaceutics. What are the important subjects about pharmaceutics?
Yes, I'll play. Let her display the slide.
Yeah, yes.
I'll just brief all.
Yes, sharing.
So just I'll let you know from the pharmaceutics which part will come for higher marks, which part will come for the lower marks, which we have to cover and which we have to give more time. I will say you before this display of the presentation. From the pharmaceutics, there are 4 different subjects. First is dosage form technology. dosage form technology is very, very important. In that dosage form technology, what comes under it is tablets first, then capsules, then sterile dosage forms. In sterile dosage form, there are two topics: injectables and ophthalmic products for the eye products. And then apart from that, sterilization you have to study, and after that you have to study for this uh, in the new drug delivery system, NDDS. New drug delivery systems are very important concerning to this dosage form technology. This is advanced techniques you have to study: nanoparticles, liposomes, different sustained release dosage forms, delayed release dosage forms. Then in that means there are new drug delivery systems you have to study for the modified dosage form, I can say. So all these dosage forms you have to study from dosage form technology. If you come to the other part of the pharmaceutics, very important I can say is biopharmaceutics. In biopharmaceutics, you have to study for the absorption, distribution, metabolism, and excretion. So these four topics, and apart from that, bioavailability and compartmental modeling is very important. Bioavailability and compartmental modeling. Hope you are getting to note it. Note it down whatever I am saying. Just what I said in the dosage form technology. First and foremost important, you will start first from that. Second, I am saying you biopharmaceutics. After completing the dosage form technology, you will come to the biopharmaceutics. And at topics I am saying from biopharmaceutics, they are very, very important topics. 6 topics are there. And then third most important is physical pharmacy. In physical pharmacy, you have to study micromeritics. 1 or 2 questions I got from micromeritics in my exams. So I can say you micromeritics first, then interfacial phenomena, then rheology, then you go for the colloidal dispersions, then you go for the coarse dispersions, and then you go for the complexes. This is sequence wise topics I am saying, importance of those topics. Sequence wise. So this is about physical pharmacy. Now, if you come to the fourth part of this pharmaceutics, I can say you fourth important list in the list is your unit operations. Unit operations, it is nothing but pharmaceutical engineering. So pharmaceutical engineering is having different kind of unit operation, like distillation, like evaporation, like you will be having different topics of flow of fluid. So there are laminar flow, turbulent flow, like that. Crystallization, you will be having crystallization topic. You will be having different other topics also are there for unit operation. Unit operation means there are machineries you have to study, different machineries, process of those machineries you have to study. So that is fourth most important. First most important is dosage form technology. Second most important is biopharmaceutics. Third most important is physical pharmacy, and fourth number comes for the pharmaceutical engineering part. Okay. Now coming to the physical pharmacy, I am taking rheology from the physical pharmacy. This topic is very cute topic, I can say. Cute topic means we are going to study here how flow is, how flow behavior for the fluids. Now I am having water. I'm throwing water somewhere. I don't know science about it. If I am flowing water somewhere, I don't know science behind it. So know the science of flow. Okay. Science of flow means the rheology. We are getting to know about it very soon. So go for the next. just behind that part to cover. Behind one slide, part to cover. Yes. Please show the slide. Please show the slide and show the content in the slide. Go in the slideshow and show the second slide. So in part to cover, what I am covering is what exactly this pharmaceutical rheology is, then what importance of pharmaceutical rheology in your pharmaceutical development. Why it is important? Because if you don't know about flow, okay, if you are filling any suspension, if you are filling the solution bottles, if you don't know about viscosity of the material, how you are able to fill it, how do you know about how much time it will take for the filling. So knowing the viscosity of any fluid you are operating is very important. Then which instrument you will be using for knowing this viscosity is very important. Different aspects or different types of viscosities are very important. And then rheology, what type of rheological behavior different types of this fluid will show, that is very important. Now we will come to the intro part of this topic. Here all will be able to see one block, right? That block is confined and stable at the bottom. At bottom is not movable. This block is not movable from the bottom, and from the top somebody has forcefully displaced it. So from bottom it is sticked. It is not displacing from the bottom, but from the top somebody has applied one force F dash, and it is displaced for the some distance, and distance is dV, and displaced for some velocity it is getting, that is dV, change in the velocity. And this velocity is different at different part of the block. At bottom it is different, at middle it is different, at top it is different. At top displacement is high, at middle level displacement is less, at bottom level displacement is very less or negligible. So wherever force you are applying, right, there only it is changing with the distance dV. That is the reason it is given the symbol of dV. So force per unit area we have applied on the area, right? Area A. So first force per unit area applied is nothing but your shear stress. Means the amount of shear stress you applied on the fluid is nothing but force per unit area. So what will be the unit for shear stress? Can anybody tell me? Force per unit area. Force, it is Newton or Dynes, area centimeter square, right? So Dynes per centimeter square will be the unit for shear stress. Why? Because shear stress is nothing but force applied per unit area. Now coming to the shear rate. Rate is different from bottom to top, right? Rate means it is not dV, it is dV by dr. Means change in rate per unit distance. dV by dr is your rate of shear, dV by dr. So what will be the unit for rate of shear? dV means velocity. Velocity is nothing but centimeter per second, right? Centimeter per second. And what is the unit for this R? R is the distance.
from bottom to top, right? dr, change in distance from the bottom to top, dr. r distance nothing but centimeter. Smaller unit of this distance is centimeter. Now centimeter, and this is dv. V is centimeter per second. So if you apply centimeter per second divided by centimeter, right? If you cross the centimeter per second divided by centimeter, means if you can cut down the centimeter, what remains is second inverse. Second inverse will remain. So the unit of dv by dr, nothing but what? Rate of shear. The unit will be per second. Rate of shear is having unit of per second, means second inverse. Why? I already told you, dv by dr, dv means centimeter per second, and dr 1 by dr means centimeter. Okay, if you do the calculation, centimeter will cut, what remains will 1 by second. 1 by second is nothing but the centimeter inverse, second inverse, or it is called as per second. So unit of shear stress is already told you, and the shear unit of this rate of shear I already told you, right? So this is from this you will be able to calculate unit of viscosity. Why? Because this shear stress is directly proportional to rate of shear. F dash upon A is directly proportional to dv by dr. And now if you see that F dash upon A, if you do proportionality into equality, then you have to take a constant. Then F dash upon A is equal to eta into dv by dr, right? So eta, which is smaller n, looking like smaller n, is nothing but viscosity. And now if you see the unit of the viscosity, if you want to calculate, then eta is equal to shear stress upon rate of shear. So if you calculate the unit of shear stress and the rate of shear, based on that you will be able to calculate the unit of viscosity. And the unit of viscosity is dyne second upon centimeter square. After calculation, you are seeing here I have mentioned in the white calculation for this, right? How I calculated this, dyne second per centimeter square is the unit of viscosity. Anybody can ask you, and it is equal to centipoise. So if somebody is asking you question like centipoise means, centipoise is the unit of viscosity, it is called eta, and unit of viscosity is dyne second per centimeter square, which is nothing but centipoise. All understood about this? Please go for the next slide. Okay. Now we have learned about the viscosity, right? What is unit of viscosity? There are different types of viscosity. Okay. What we studied is the dynamic viscosity, or we can say it the absolute viscosity. But there is another concept called kinematic viscosity. Kinematic viscosity is nothing but absolute viscosity divided by density. Okay, divided by density. And the unit of kinematic viscosity is not centipoise. Not centipoise. If somebody will ask you the unit of kinematic viscosity, then don't tell them centipoise. Kinematic viscosity unit is Stokes, and the smaller unit is centistokes. Okay, you all must have understood. Now coming to the liquids which are having different types of viscosity. If you go for in the list, castor oil is having highest viscosity. In the list, water is having low viscosity, chloroform is having lowest viscosity. Why? Now, if you see water is equal to 1 viscosity, right? Olive oil is 100, castor oil is 1000. So this is the reason there are different types of in one exam I remember that the directly viscosity of water and castor oil were asked. Okay, so that's why I sticked here the table which is showing different important solvents which are there from this this subject. Okay, go next. Go next. Please go next. Are you able to listen me? Okay, so there are different types of flow behaviors for the liquids. One is Newtonian flow and another is non-Newtonian flow. Okay, Newtonian flow means if you apply the shear stress, rate of shear will increase proportionally. There is no in proportional increase or decrease in the rate of shear with shear stress. If you go for non-Newtonian flow, then there are different types of flow behaviors which will sometimes increase with the shear stress, sometimes decrease with the shear stress. You all must understood now what is shear stress, right? You all must have understood what is shear stress. Shear stress is nothing but force applied per unit area, and rate of shear means the moving capacity. Okay, dV by dr. So dV by dr is higher means moving capacity higher at lower force also. Sometimes dV by dr is lower at higher force also, means more viscosity, right? So higher the shear stress required for moving, it will be having higher viscosity. Lower the force shear stress required for moving means it is having lower higher viscosity, like that, vice versa. Okay, so what I can say you, the Newtonian flow, any liquid which is not mixed with another type of fluid or material will show you Newtonian behavior. Non-Newtonian means anything which is mixed with many ingredients will show you non-Newtonian type of flow. Okay, if question will be asked on the castor oil is having higher viscosity, but it will not show non-Newtonian flow. It will show Newtonian flow. Sometimes people will be able to, people can get confused in this Newtonian flow, non-Newtonian flow, and this viscosity. There is no need to confuse anything which is a pure liquid. Castor oil, it is pure liquid. If it converts into the emulsion, it is not pure liquid. But the alone, any material is pure liquid, and if anything mentioned as a pure liquid will be having a Newtonian flow. Anything like emulsion, suspension, there are mixed substances, paste, cherry, jelly, all those are mixture of something. So those will show non-Newtonian type of flow. Okay, now go for the next. So the Newtonian flow curve will go straight. In one exam, there are directly curves were asked for in the 4 options. 3 options from the non-Newtonian and 1 option as a Newtonian. From 4 only they ask for one material flow, and from that one have to pick the flow behavior for that material. So Newtonian flow, rate of shear should be directly proportional to the shear stress. Means if you displace with this much force, this much rate of shear will happen at the start, and that if you continue the shear stress at the last also, same rate of shear will be applied on that. If you increase the shear stress initially, for example, for say 10, and then rate of shear will also be 10. If you increase with the shear stress of 20, then later on also it will become a 20. So the curve will go straight for this. And examples of these is pure liquids, castor oil, water, chloroform. You will not able to hurt any kind of liquid which is mixed with some other liquid or solid. So that will come into the non-Newtonian. Anything which is pure name of one material will come as a Newtonian. Please go next. So non-Newtonian flow, there are three types of non-Newtonian flow. One is plastic, another is pseudoplastic, and third one is dilatant, right? So if you come for the plastic are nothing but plastics are nothing but the Bingham bodies. They are called as Bingham body. Okay. Just a minute. Okay. So plastic flow is nothing but the Bingham bodies, because these bodies will at initial will not flow much. Okay, initially they will resist for the flow. If you apply some kind of force or shear stress, they you are seeing a one dotted line. Okay, up to that dotted line they will not flow. After that they will flow. Some kind of students, unless and until they get bitten, they will not start for the studies, right? Like that. And somebody have to bitten for 1 hour, somebody have to bitten for this half an hour. That is their yield value means until that kind of force, they will not start their Newtonian flow, right? Shear stress equal to rate of shear. They will not start unless and until you will apply a force up to yield value, right? So this yield value is nothing but the force applied up to the extent where the fluid automatically get into the Newtonian flow. So this is called plastic flow, plastic behavior. And the viscosity for this kind of viscosity is called as plastic viscosity, right? Plastic viscosity. Now I'll explain you two terms. One is mobility and one is fluidity. Mobility and fluidity. Out of all of you, have anybody already studied these two concepts of mobility and fluidity? Have anybody studied about mobility and fluidity before? Mobility is nothing but, fluidity is nothing but reciprocal of Newtonian viscosity, means 1 by Newtonian viscosity. 1 divided by Newtonian viscosity means fluidity, and 1 divided by plastic viscosity is nothing but mobility. Okay, nothing but it is called as mobility. So mobility is the reciprocal of plastic viscosity, and fluidity is the reciprocal of Newtonian viscosity. Okay, so small f is nothing but the yield value. Capital F minus small f is the shear stress for this plastic behavior. Okay, so this kind of so if you go for the viscosity, plastic viscosity, the formula is capital F minus small f upon G. And if you go for the formula of Newtonian flow, it is capital F upon capital G, means shear stress divided by rate of shear. Here shear stress minus yield value divided by rate of shear is the formula for the plastic viscosity. Okay, and for Newtonian viscosity, capital F upon capital G, that is rate shear stress upon rate of shear. And here in plastic viscosity, shear stress minus the yield value upon rate of shear, because we have to minus the yield value from plastic viscosity. Okay, please go next. And plastic viscosity examples are, for example, flocculated suspension. Why flocculated suspension initially show yield value and then go for the Newtonian kind of fluid? Because can anybody able to explain this, why plastic behavior is shown by this kind of materials? Flocculated suspension. Only flocculated suspension can show this kind of behavior of having yield value. Can anybody tell me? Actually, initially this flocculated suspension will be having structured suspension, and initially if you apply a yield value, force up to yield value, that require for breaking the forces. If you don't apply up to the yield value, it will regain into the original state. It will not flow like a Newtonian liquid. So this is the reason initially to break the floccules, of flocculated suspension, force up to yield value is required. After that, it will go like a Newtonian. So this is the reason what we are doing. We are applying yield value, and we are having the example of plastic behavior type of flow from the flocculated suspension. Okay, please go next. Okay, now coming to the second part of non-Newtonian flow, that is pseudoplastic. Are we able to understand about pseudoplastic? Pseudoplastic is the liquid. First, initially they will resist for the flow. That is the reason bottom curve is kinda curvy in nature, right? It will not a straight line. It will go slow initially, and once half of the force is completed, now much force is not required for the shear rate. It will automatically more than Newtonian also it will flow. More than Newtonian it will flow by applying shear stress later on. So what must have happened? Initially it required more force for the flow, and after some time of agitation, it required less force for the flow. Why it is happening? Why curve is less straight at the start, and it go on straight later on, and it curve like to backside later on? Why it is happening? It is called shear thinning system. What it called? Shear thinning means we are giving shear and the liquid become thin, and that is the reason when we applying the force, it is not resisting for the flow. Flow is becoming easier. Flow is become easier. Now imagine if you are having polymeric substance like threads. You are having some threads in your hand, and they are entangled with each other, and now you have put those threads into the water, and now you are stirring that water. Those threads which are entangled with each other, when you are stirring, they will align themselves into the fashion of flow, and that is the reason initially they were entangled with each other in non-fashion. Now they are now flowing with the one fashion, and they are not resisting for the flow later on because of the alignment, and that's why the rate of shear stress is require less to having more shear rate, right? So that is the reason less force is required later on once they align themselves in the structure. So this is the reason some polymeric nature compounds, means any compound which is solubilized, polymeric compound solubilized in water, like HPMC polymer, HPC polymer, any polymer which is polymeric substance which is solubilized or dispersed in the water will show non-Newtonian flow behavior, like pseudoplastic flow behavior. Pseudoplastic and the pseudoplastic substances are called as shear thinning substances because they are making the system thin, not thick, thin. And that is the reason what is happening. Because of the shear thinning, less force is required later on, and the curve is going back rather than going straight, rather than going less from the straight. It is coming back and it is going faster. So this is the non-Newtonian flow, and this is called pseudoplastic behavior of the substance. Okay, now if I'll ask a simple question like, which compound from the following will show you pseudoplastic behavior? Okay, option number 1 is flocculated suspension. Option number 2 is deflocculated suspension. Option number 3 is your solution of HPMC in water. And option number 4 is none of the above. Which will show? Can anybody tell me from 4 options which will show pseudoplastic? Option 3, okay. Hasita is saying option 3. Is anybody having any other option for this? Option 3 is solution of HPMC in water. Now question will be same. Now I'll change the options. Solution of HPC, hydroxypropyl cellulose in water. Solution of gelatin in water. Third, I'll say solution of HPMC in water. And fourth option is all of the above. Question will remain same. Which of the following is pseudoplastic? Only options are changing. Solution of hydroxypropyl cellulose in water, solution of gelatin in water, solution of HPMC in water, and all of the above. Okay, Varun and Hasita is saying all of the above. That is correct. Because hydroxypropyl cellulose is also polymer, HPMC is also polymer, gelatin is also polymer. When they come into the contact with water, they will form the polymeric solution of water and polymeric dispersion also we can say, and that will show a pseudoplastic or shear thinning system. Okay, now we will go ahead for this next slide. In this next slide, this is a self-explanatory slide. We can show that non-Newtonian flow, right? Third part of non-Newtonian flow is dilatant flow. What is happening in this? In this, it is opposite to that of shear thinning system. These are shear thickening system. What is happening here? Shear thickening system is coming into the picture. Shear thickening. Initially, solution will be easy for the movement. Later on, it is getting hard for the movement. Means initially, whatever the shear stress I have to apply for getting XYZ shear rate is less initially. Means rate of shear is high and shear stress is less. Later on, what is happening? If I am applying higher force per unit area, shear stress also, movement is becoming less. Okay, why it is happening? Why rate of shear is decreasing and shear stress is increasing? Because this this system is becoming thicken, like unlike your shear thinning system, unlike your pseudoplastic behavior, this is a dilatant. What is happening? What is science behind it? Is initially what must be there, some of the particles must be there in the system. Those particles are wetted with the solvent. Every particle is having solvent around them. If you are stirring that solvent and that particle initially, and the particle, and in that system water or any solvent is there, that is less in quantity. If it is less in quantity initially, and system, because of the increasing shear stress, system is getting dilated means now that solvent is dispersed and some of the solid particles came contact with each other and they are not having any solvent for the friction, and this is the reason, and now they are frictioning with each other. That is the reason they are resisting for the flow. Okay, so initially system was not dilated, particles were having enough volume, enough vehicle between those particles. After that, system is getting dilated because of the stirring or because of the shear stress. Now they are having less wide volumes in between the increased wide volumes and less solvent between them, and a solvent becoming insufficient to lubricate those particles, and those particles are becoming thickened, and now they are resisting for the flow. For example, paste is having already less water into that. So what will happen if you go for the viscosity measurement of the paste? Initial viscosity of the paste will always come higher, and later on viscosity, sorry, always come lower, and later on viscosity will get increased. Why it is happening? Because of the shear stress increased, it is getting dilated, and because of that dilation, paste is having less vehicle already into that, and now this vehicle is insufficient for those particles. That's why that's why that's why it is showing a dilatant flow. Now I am having example of paste is nothing but deflocculated suspension. I am saying you flocculated is nothing but your plastic, but this is dilatant is deflocculated suspension, but it is in concentrated form, not a dilute suspension. 3-4% dilute suspension will not show this kind of dilatant behavior. Dilatant behavior will be shown by suspension which is having 50% of solid content, 50% and more than that solid content if you have, and less water, 50% and less water if you have into the system, then it will show a dilatant flow. Now if I can say you any another example, a deflocculated suspension, any toothpaste or anything will show you deflocculated type of flow, or deflocculated suspension will show you dilatant type of flow. Okay, so three behaviors, flow behaviors we have seen. Plastic behavior, in that yield value is required to initiate the flow and then it will go as a Newtonian. That is the reason F minus small f divided by G is the formula for this plastic. Then we came for the this pseudoplastic. Then we came for the dilatant. Right? We learned about the examples of pseudoplastic, plastic, and dilatant flow, Newtonian also. So anything, any example from all of these three, if get asked, my students are now able to answer that, right? Right? All of you able to answer the examples from all of these flow behaviors? Okay, thank you guys. Now, please go for the next slide. Now the concept of thixotropy comes. We have seen up to the up curve, means at the top of curve. We didn't see when we come back at the bottom. When we come back again, what is happening? When we come back again, the up curve is at right and down curve is at left. Means down curve means when we are reducing stress, shear stress, rate of shear will be less when we reducing shear stress. What is happening when we are coming down? When we are coming down, this whatever the fluid we have seen at the right curve is shifting to left curve, means the viscosity is becoming less when we come as a down curve. That is the reason it is shifted to left. Okay, shear stress required is less when we come down, right? This is why it is happening, because when we go up curve, we disturb the structure of the solution, right? And to come up to the original state of the any solution or suspension, it takes time. That is the reason when you again apply the shear stress, it requires less for any fluid, because you have already disturbed that fluid. Okay, only few kind of fluids will gain the thickening when you come for the down curve. Those kind of magnesia magma is the example of that. Otherwise all curve shift to left. All curve will shift to left, and only in one concept curve will shift at right is anti-thixotropy, or it's called as negative thixotropy, and it is shown by only one compound in the world. It is called magnesia magma. Okay, so keep in mind that magnesia magma will show the anti-thixotropy, or it is called as negative thixotropy. It is shown by the magnesia magma, negative thixotropy. And if you have the thixotropy example are n number of examples. So any fluid will show thixotropy. Negative thixotropy will be shown by the magnesia magma. Okay, so this is coming to the left side. Curve is coming to the left side. So if you applied shear stress for longer time, first box from the left side, if you see, if you apply shear stress for longer time, it will come more to the left. Or if you apply more shear stress, it will come to the left, more to the left. So this is obvious that if you apply shear stress for longer time, it will disturb it for longer time. It will easy to flow again, and down curve will come to the shift to the left. All will be able to understand this logically. But negative thixotropy is not understandable logically. Just keep in mind example, because that can be asked. Okay, go ahead for the next. Okay, so special thixotropic curve. If you are able to see this red curve is nothing but shifting to the right? Shifting to the right, that is negative thixotropic curve. Now there are special thixotropic curve. First is bulge. Second is spur. Okay, bulge and spur, and third one is negative thixotropy. Why bulge is happening? Bulge is happening because bentonite magma. Okay, one example of bulge is bentonite magma. You should write it. Okay, directly question will be asked on this. So bentonite magma will show the bulge like curve because it is having a house of card like structure, and that house of card like structure, if you apply some stress for the breaking it, later on it will show a immediate minus curve, or curve shifted to left side. That's why it form a bulge like structure in the table 1, in the figure 1. So second figure is showing spore like structure. It is shown by penicillin. Okay, because of the immediate structural breakdown of penicillin, procaine penicillin gel, intramuscular injection, it will immediately show a spore-like structure, and then it will break into the structure, and then it will go straight. That is the reason it will form a sharp edge-like structure at the bottom, spore-like structure at the bottom. So these are three curves shown by three types of compounds. You just have to understand the concept. You have to understand the example. That's it. Only one example from each of the figure is coming. First figure, bentonite magma. Second figure, Procaine penicillin G. Third figure is your negative thixotropy shown by the magnesia magma. Okay. Go for the next. Now there are examples of viscometer to check it. Okay, viscometer to check it. Now I'll tell you, if curve is straight line curve, if curve is straight line curve, and if I'm having only 1 point of viscosity measurement, only 1 point of viscosity measurement, will it be sufficient for, if I'm having a graph, and if I am measuring only 1 point in the graph for the viscosity of solution is 60. Okay, 60 centipoise. Now will it be sufficient to measure the nature of non-Newtonian fluid? Will it be able to sufficient to know the nature of non-Newtonian flow? Only one viscosity point. Only one viscosity point. Will it be able to measure the flow behavior of non-Newtonian? It is giving only one value of viscosity. If it is giving 60, it will give 60. If it is giving 100, means it is giving 100. It is not giving 4 or 5 points of viscosity. It is giving only 1 point. Will it be sufficient for measuring the nature of non-Newtonian fluid? Non-Newtonian fluid curve will changes with the shear stress. It will change with the shear stress. If I am applying 100 shear stress, it will change right now. If I am applying 200, it will change right now. It will give different type of viscosity values at different time points. Will it be able to sufficient? Yes. Correct. Varun, Asita, both are correct. So this I can say you. There are requirement of multi-point viscometer. Multi-point means at least 4 point, 5 point. If you paste on the graph, if I got 5 different values of the viscosity, okay, initially 50, then it is coming 70, then it is coming 100, then it is coming 120, then it is coming 150, right? Which kind of curve it will form? Which kind of curve it will form? First viscosity value is 50, second is 70, third is 100, then it is 120. Which behavior it is? Increase in viscosity with increase in shear stress. This will show you curve of shear thickening system, right? Shear thickening system. So for measuring shear thickening system, shear thinning system, plastic system, we require a 4-5 point apparatus to know the viscosity at different time points, right? So this is the reason multi-point viscometer is used for non-Newtonian fluids, and this is the reason. And now if my graph is straight line graph, and if I got a 1 point only, then straight line graph, if one dot also I got, I can apply a straight line from that dot from x and y axis. I am getting the graph, right? So this is the reason Newtonian fluid will require 1 point viscometer. Okay, if I am measuring Newtonian fluid also from 4-5 point viscometer, that is good, very good. But 1 point viscometer is also sufficient for measuring Newtonian fluid viscosity. But for measuring non-Newtonian fluid viscosity, 1 point viscometer is not sufficient. Okay, keep this in mind. Now, what we have to do is which kind of viscometer we have to select based on the nature of liquid. Now, first one is from the table capillary viscometer. Capillary viscometer, keep it in mind that this is 1-point viscometer only. Second, falling sphere viscometer. This is also 1-point viscometer. Okay. And the examples I have already mentioned. Capillary viscometer is Ostwald viscometer and falling sphere viscometer is Hopler's viscometer. Now, I'll tell you the story of 2017 GPAT. Question came like falling sphere viscometer is from the following. And options were Ostwald viscometer, Hopler viscometer, then McMichael viscometer, Ferranti-Shirley viscometer. Which is that? The correct option is Hopler viscometer. Hopler viscometer is an example of falling sphere viscometer. You can remember like HH, okay? FH, sorry. Falling sphere viscometer. Hopler's viscometer. Okay, capillary viscometer is Ostwald viscometer. Then coming to the cup and bob viscometer, cone and plate viscometer, and rotating cup, rotating bob. Cup and bob are having two subtypes. One is rotating cup and rotating bob. Another is cone and plate viscometer. Cone and plate viscometer require very less sample for analysis, very less sample. And the example is Ferranti-Shirley viscometer. Okay, cup and bob viscometer are two types. Rotating cup, Corti type. Okay, rotating bob, roto viscometer. Okay, roto viscometer is an example. McMichael viscometer for rotating cup and for rotating bob, roto viscometer is an example. But if you go for deep into the working of those viscometers, okay, rotating cup and bob viscometer is there. It is having an issue of plug flow. Plug flow means there is a gap between cup and bob. If that rotating bob is there and cup is there, if in between the distance between cup and bob, if applied the particles which are near to the cup and near to the bob will get more crushing, and particle in between the those distance will get less, will experience less crushing. That is the reason they can show a plug type of flow, right? Means different type of shear stress applied at different distances. This should not happen, right? So this is the issue related with the cup and bob viscometer, and this is a well-known issue called plug flow. Other viscometer don't show any kind of issues. Okay, and capillary viscometer and falling sphere viscometer are only required for the measuring Newtonian fluid. Okay, others can measure any kind of fluid. Okay, so I hope everybody is clear about this. Everybody is clear up to this point? Is everybody clear up to this point? Now please be prepared like this only. Prepare your topics. Whatever I said, keep it in mind that how to study, what to cover first, what to cover later, everything. And don't waste time and start preparing from right now. Nobody will take your success out from you. I'm sure I'm happy that you are got to know this at very early stage. Okay, you have sufficient time. Don't waste your time and start immediately. Okay, so all the best everyone. We'll meet you for the next session. Okay, I'm happy that you have listened, you have survived till now. Thank you so much. Thank you everyone.